Hi, good afternoon. I'm re-recording the beginning of the training. I just wanted to introduce myself and my team, which you'll see in the rest of this training. My name is Dr Miric, and we are the mental health care for COVID-19 healthcare workers in Gauteng team. We are a volunteer mental health team made up of psychiatrists and psychologists, and I will introduce my team as we go along. And we put this presentation together in order to explain to you what we are about, who we are, and then just to go over some of the research which we have explored and share some of that with you. So I do hope you enjoy it. Probably about 2.5 months ago, I was sitting trying to figure out how to best support healthcare workers through this pandemic. And I was watching the literature all over the world and seeing what was happening in China and Italy. And then I decided to get together a group of colleagues, and we decided to make this team, which is forming the response, the voluntary mental health response. We are, as I said, the mental health care for COVID healthcare workers team, and we are a subgroup of the newly formed healthcare workers care network, which you'll hear more about, because emails will be coming either from myself, from the Gauteng group, or from the national group. These are the members of my team. I'm sure some of you will recognize some of the names. So we really have a great group, and we've been working really hard to figure out what is the best response, how can we best help healthcare workers. So there's 7 psychiatrists and 7 psychologists. So before we start, I just want, I'm very aware that we're talking about healthcare workers, but that all of us are healthcare workers. So I'd like you to look at this this very well-known pyramid, which is, Maslow's pyramids of needs, and look at them in terms of yourself, but also look at them in terms of your potential clients and the healthcare workers. So this is the model we are following. It forms one of the big groundworks for what we are doing, and we've been working, trying to see where the healthcare workers are in terms of which level of need. And as you know, we can't be talking about esteem and love and belonging when the basic needs aren't sorted out. Now, unfortunately, there's not much we can do about these basic needs, but we can support initiatives around the basic needs, and we can also decrease anxiety around, the safety and the basic needs and talk through it. We would love to provide solutions, but we can't. But this is a practical model of where the healthcare care workers may be sitting, and we'll go into that a bit further. But I think also to just take note that we are also healthcare workers. And I was actually speaking to one of my colleagues just before this, and I do think that we must be very careful of the mental health care professionals burning out through this pandemic, because I suspect the work is going to get more. Obviously of our patients, and then hopefully we will have an additional load of the healthcare workers. That's if they reach out for help. Through the presentation, there's going to be a few speakers, and I'm going to hand over to each speaker as we go. So the first speaker I'm going to hand over to is my colleague Ramasar, who's a psychiatrist in private practice. Yeah.
Good afternoon, everybody. Thank you for joining us on a Saturday afternoon. So my role in this whole project is to actually coordinate the effects or the efforts from our team in order to train the leaders. And the reason why we chose to do this, we actually work on a 2-pronged approach. So the first prong is basically to target the leaders, to train them from a top-down approach. And the second prong is to look at individual healthcare workers and how we can help them on an individual basis. So why did we choose to do this? Essentially, the first thing was to target team leaders in order to get the message across to as many people as possible. Because as you know, we don't have unlimited resources in South Africa. And the second reason is because the research actually shows that this is probably one of the best ways to go. So as you all know, research consistently shows an increased stress in healthcare professionals in normal situations, which in turn leads to an increased risk of physical and mental health problems in the healthcare workers, including ourselves. And if you look at doctors, particularly as an occupational group, the risk of suicidality and even completed suicide is higher than in most other occupational groups. Now, the research that we've looked at shows that during pandemics and disasters, particularly, this risk further increases. And evidence has shown that employer support and leader support actually is very protective for the employees and their families. It serves to reduce stigma so that it improves health-seeking behavior, which, as you all know, as healthcare workers, we are notorious for not seeking help. So we're hoping that by encouraging the leaders to talk openly about these issues, they encourage healthcare professionals, especially on the front line, to seek help from us. And the last thing is that it creates the right team ethos. Now, Neil Greenberg said it very nicely this year when he said much of the resilience of an organization may lie in the social bonds between staff members rather than the individuals. Now, when we speak to the leaders, we actually describe them as leaders on the forefront of a battle. And I know that you were all thinking of this pandemic as a war. So it's very useful to think of the battle as occurring in phases. And one of the things we look at with them is explaining the different phases and what comes with it. Because each phase, as you know, has its own challenges, common physiological or psychological responses, and there's possible solutions as well. So there's 6 phases, which I'm going to go through in a little bit of detail so that you're just on the same page as us. So moving on. In the preparation phase, that's the planning and anticipation phase, as you know. It's where there's lots of information or too little information, and we need to educate ourselves. And the staff challenges here are 1, the anticipatory anxiety. So most of us actually don't know when the tsunami wave is going to hit, if it actually is going to hit, and then there's the possible denial, or how large this wave will be when it finally reaches the shores. Now, apart from that, there's also the anxiety, the uncertainty, and the discomfort that we're all feeling while we're still gaining a lot of experience in treating or managing patients with COVID-19. Then there's the overwhelming physical and emotional signs of tension that you might see. And then there's the information overload versus the lack of information. Moving on into the early phase, which is probably where we're situated now, there's a small number of positive patients, there's vigilance regarding resources, and there's some ethical dilemmas that are starting to arise, or some ethical dilemmas that we're starting to think about. And here we notice that anticipatory anxiety is actually heightening. I'm sure most of you are feeling this as well. And there's an increase in psychosomatic symptoms, there's possible denial or overdrive. In the mid phase, which we're looking at next, there's many more positive cases daily. There's possibly insufficient equipment. We need to start covering for colleagues because more people are getting sick. And there's now challenging ethical decisions. Here, the staff challenges actually start to increase. The distress and the worry increases. The staff now might feel unable to cope. They're quite overwhelmed. Some are on overdrive. And we notice that they start to deplete their personal reserves and they start to run on empty, which leads them into the peak phase where they're already running on empty. And here, you know, the cases are overloaded. There's insufficient capacity due to the patient numbers. There's collapse of structures. There's basically an all hands on deck approach. And there's challenging ethical decisions like who gets the ventilator and who doesn't. And here we start to feel more distressed, more overwhelmed. We may feel unable to cope. And then the staff burnout starts, which leads us then into the tail-off phase, where we get more capacity and there's still minor ethical dilemmas, but the staff by this time are running on empty. Many of them are working with burnout, And there's the potential for retrospective guilt as well over the decisions that they have had to make. We then move on to the post-COVID phase. And that's where we have the full technical capacity, but there's still reduced number of staff and reduced numbers of staff, and their functioning is not as good. Where there's the delayed stress response, the retrospective guilt again, and there's the delayed psychological impact of what we've all gone through. And this is more than likely what they're calling the second pandemic, because those of you who've been reading probably have heard, they anticipate the second pandemic to be that of mental health problems. So we like to give the leaders a very good understanding of that before we actually move on to more details in terms of the principles of responding for sustained staff well-being. So I'm not going to go through all these slides. Sorry, apologies for that. My husband is actually a healthcare worker and sitting across from me and trying to listen in as well.
Please ask Marvin to not do that. So thank you.
He's just a psychiatrist. He's not technologically. Okay, so moving on, one of the things we do here is we discuss within the principles of responding for sustained staff well-being, as I mentioned. And most of these principles actually are just common sense, and which I'm sure all of you know about. I'm not going to go into detail. It's just to give you an idea of what we look at. These are some of the slides that we discuss in the training. However, there's a lot more, and we will make it available to you should you wish to do any of the training. So there's 4 things that we actually look at. We look at visible leadership, honest, clear, regular communication, promoting staff well-being, and building team cohesion. So just very quickly from the visible leadership, we encourage them to be visible, available, and supportive, and be firm but compassionate at the same time. And the reason for this is that all of this information is from studies that we've read, and more than one study has actually shown that the most potent way to allay the fears of the healthcare workers, irrespective of their grade or their role, those on the front line, is to actually with compassionate leadership. And in order to build compassionate leadership, we encourage the leaders to be honest, clear, and have regular communication. So that's preparing the staff, being honest with them, simplifying their protocols, and then moving on, actively listening to them, not overreacting, rather overprotecting. We encourage them to normalize feelings, so to keep the natural coping mechanism going for as long as possible. We ask them not to minimize fear, nor to exaggerate crisis, and then to establish themselves as the calm center of the storm. Because actually what we're looking at is capable calm. So we also look at promoting their staff well-being by staying well, creating time-out spaces, giving them stress tips, and then a wellness and safety plan, as well as looking at the pragmatics of the situation, praising them, checking in with them, supporting them as they need it, and then looking at the circle of influence. And then lastly, we look at building team cohesion. And once again, we stress the importance of regular, continuous, honest communication. And we're encouraging 2-minute check-ins on a daily basis with the team members, as well as praise and acknowledgement, regular meetings, support system, calmly identifying reasons after a shift and how to improve the practices. We are not encouraging trauma debriefing. What we are rather saying is after each shift, have an end of shift meeting, just calmly identify reasons for the outcomes, how you improve this, and then look at identifying any of the team members who may need a little bit more assistance that day, and then addressing staff conflict. Now, one of the questions we've actually had in our training thus far, and we've trained over 500 people, is we don't have time. How do we go about doing this? So that brings us to the next slide, where we actually have shown them that from the studies that they've looked at thus far, time spent in these kinds of meetings actually increases the overall productivity by more than 35%, and it increases staff well-being. And we explained to them this is not a marathon. This is a marathon, not a sprint, but actually recently we're starting to think of this more as a relay, emphasizing the importance of the teamwork and good supportive social relationships at work. Essentially what we're trying to get them to do is to prepare their team now before the storm hits and to build resilience and prevent burnout. However, saying this, we do realize that depending on the stage or the phase of the pandemic, we may need to change this training. And once we do, we will ensure that we give you further training as well. Thank you.